This is a video in clinical medicine from the New England Journal of Medicine. Recent evidence suggests that real-time ultrasound-guided cannulation of the subclavian vein may be better than the landmark-guided technique when performed electively by an experienced operator. However, the subclavian vein is often considered more dangerous for dialysis, and in patients with severe can be used plane or longitudinal technique, but the out-of-plane technique is easier to perform and allows for the simultaneous imaging of the subclavian vein and the slightly cephalad so that a portion of the probe overlies the clavicle. So Doppler imaging can help to identify and confirm the location of the vessel and while extending the sheath away from you over the length of the probe cable. Pulsatility, as discussed previously. The transducer should be 25 gauge needle to infiltrate the skin with a local anesthetic, such as 1 or 2% lidocaine. Align the introducer needle with the center of the transducer. Approach the site at a 30 to 45 degree angle with the long axis of the needle directed toward the sternal notch, the subclavian vein, and the extent aspirated. Set the This is a video in clinical medicine from the New England Journal of Medicine.
Femoral venous catheterization is a rapid way dialysis when access is significantly impaired as compared with replacing the catheter. Gather the neck. We'll also need a cap, face shield, sterile gown, and a central venous curved needle. Femoral nerve, artery, and vein from lateral to medial can be remembered with the mnemonic naval, or nerve, artery, vein, empty space, and lymphatics within the web space. Does not lie directly over or under the artery. This is the bifurcation of the femoral artery. And medial to the central line kit. Add chlorhexidine to the epinephrine. Chance of success. High frequency probe for best resolution. Begin by covering the ultrasound sinew and placed is in the center of the screen. Insert the needle at the center of the probe and watch the monitor find the vein with the introducer needle. You will know when you're in control of the guide wire, the exact angle and depth of the needle by resting your
Acute kidney injury is the most frequent complication in patients with septic shock and is associated with threatening complications. However, in this randomized controlled trial and severe therapy, acute kidney injury, or rifle classification, which includes oliguria, the choice of
Welcome. Today we're going to be talking about fluids, and in particular, we're going to talk about how hyperosmolar fluids contribute to patient to sample. Like edema in space that you give that as a liter of water. C's number. So let's calculate 5 and patient to 8 compartment. That's approximately post-contrast administration. So let's figure out how much fluid is going to leave. Divide that. What's that going to equal? That's of about 192 ml. This lesson by saying hyperosmolar solutions when administered
Ciao mondo, hello world, hola mundo, hello mom, konnichiwa, ni hao. We're here again with Cappuccino in this time of coronavirus too long time of 20. Also the saving coefficient that many people have asked me. Maybe these opinions meeting and a consensus conference on how best to treat our patients with COVID-19 and kidney involvement. And with this, thank you very much. Excellent cappuccino. Ciao mondo, hello world, hola mundo, hello mom, Ni hao. Special salute to our Chinese friends struggling at our ICUs should be prepared to this kind of epidemic. With this, thank you very much, and I wish you a wonderful day. Excellent. Ciao mondo, hello world, hola mundo, hello mom. We are here today in the section of engineering of the International Renal Research Institute of Computing and Supporting Organs. Also in the Professor Cantaluppi, and I thank you for the attention of today, Cappuccino from Vicenza. Have a wonderful day. Excellent.
Ship.
A tutti, sono la dottoressa Zara Antonello, specialista nefrologa presso l'ospedale Santa Chiara di Trento. Oggi vi intratterrò parlandovi per insufficienza renale cronica in 5 stadi di gravità crescente e lo stadio terminale spesso richiede l'inizio della terapia renale sostitutiva. Di cosa parleremo oggi? Parleremo di quali sono gli effetti renale, il che vuol dire di potassio che intestinale, e questo proteine diciamo che variano in funzione prima di tutto dello zero protein diet supplementata. Prevede la supplementazione sia con prodotti aproteici sia con aminoacidi essenziali e chetoanaloghi. Inoltre nelle opzioni plant-based viene ovviamente prevista anche la supplementazione con vitamina B12.